Hello everyone. You're welcome once again to our program, that is MRCOG3 Made Easy. And so this is another topic which is taken from the antenatal module, and that is a breech. Breech delivery is very important. It can come as a structured discussion. Teaching station. It can come as a teaching station, and it can come as a the similar to patient also task also, where the patient will ask the marriage management options. So and sometimes they ask for home birth. So all these things. So you need to they will be very particular about the vaginal birth. Now, so I'm going to explain, tell you about this breech presentation. What are the management options? So here we have patient who is a simulated patient task. Always see what it is. Simulated patient task or teaching station or structure discussion, and where you are, antenatal clinic or postnatal clinic, whatever. So always these two things are domain, and these things are important. So now here you are an ST5 trainee and covering the antenatal clinic. Your next patient is Mrs. Jasmine Jacob, 35 years, who is 35 weeks pregnant. This is her third pregnancy. She had two previous normal deliveries. Her midwife found her baby to be in breech presentation. So she referred her to you. Jasmine wants a home birth. And her BMI is 28, her blood group is B positive. Naturally, she will want to have home birth. Why? Because she had two normal deliveries before, and she also thinks this time also she can have. She doesn't know what is breech and what is a phallic. No. And sometimes, in this is the case, you have to think. Sometimes the breech can be missed. So previous it must be missed. It can miss also. Previously also she must have had this breech presentation. Must have been missed. Then the patient will ask why it is missed. So be prepared for all these things. Now, I'm going to start the station like this with introduction and agenda, then information gathering. So, hello, I am Dr. Manjula, one of the doctors in the antenatal clinic. May I confirm your name and age, please? I am Mrs. Jasmine Jacob, and 34-year doctor. How may I address you? You call me Jasmine, doctor. So, Jasmine, I can see from your notes that you're pregnant at 35 weeks and you're looking for home birth. Am I correct? Yes, doctor. Yes, doctor. Do you know why midwife has referred you to us? Yes, doctor. She felt the baby bottom is down. Okay, that means she knows. Sometimes she says no, but this time she says yes, she knows. Yes, doctor, because she felt baby's bottom is down. Okay, now let me tell you, I say home birth is a very good option. And home birth, Jasmine, it is a very good option because you will be at your home, comfortable in your familiar environment, no interventions, no machines, and you will be taken care throughout by the midwife also. So then I respect your decision. But let me tell you, Jasmine, let me tell you a few things. And home is birth is a good option for low risk pregnancy with head down. With head down, baby need to be head down. In your case, we have some concerns with your baby's position. Midwife on examination felt that the baby's bottom is down. That's called breech baby. And first we will. Have you heard about it anytime? No, doctor. So first we will confirm in a scan, and then we will, if it is the same position, that is, if the bottom is down, then a vaginal birth at home can have some inherent issues during delivery. So it is advisable to deliver in the hospital under consultant care. I will explain to you more about this. I'll speak about more about this thing. So after I explain about the options, I'll give you the options and also about the home birth and the normal birth and other options also. And then you decide. It is your choice whether still you want to deliver at home. And whatever decision you make after I listening to all my options, then we respect your decision. Whatever decision you take, we respect it. Okay, ma'am. Okay, Jasmine. Yes, yes, doctor. So before I explain to you, can I get a few details from you, which helps me in our management plan? Okay, doctor. Can you tell me more about this pregnancy? See, now that you are into 35 weeks, how is your pregnancy so far? And do you have any pain or any bleeding or any leaking? And how is the baby moving? Do you feel the baby's movements? And do you find any time you had any increase in the blood pressure, increase in the sugar? Or then how were your booking blood test? Were they normal? Have you done before the dating scan? And was it corresponding to your dates? How about your mid-pregnancy scan? Because mid-pregnancy is one dating scan and after the down screening scan we ask. And then mid-pregnancy scan to rule out abnormalities. Then have you done any scans after that? If she says yes, then you ask her how they are. and you see the scan reports. Then, so when was the last scan done? Then, anytime, did they get a doubt about the baby's position? That is, anytime baby was bottom down, anytime in your previous visits, and anytime in the scan after birth, was it normal location? So these things you have to ask. Huh? So now, then she says, no, doctor, this is the first time a midwife is suspected that the baby is bottom down. Before, my baby was head down only. So anything she can say. So this is what. Now, have you named your baby? How about the baby's movement kicking? Is it kick already? If you're asked, no need to repeat. Now, coming to the previous pregnancies. So, because this is third pregnancy, can I see that you have the two normal deliveries before, and can you tell me more about them, about those pregnancies? How then when did you deliver? Did you deliver in time? What or before date? Did the baby come out early? How were the babies at the time of delivery? What was the birth weight of the babies? How was your recovery? These are the things which you should ask about the previous pregnancies. Now, coming to the gynec history, were you regular with your cervical screening? Are they normal? Then, are you on any medication, long-term medication? Do you have any allergies? I see that your blood group is B positive. In case a Jasmine need arises, will you accept blood and blood products? So you're ruling out Jehovah Witness. If says no, doctor, I won't accept. Then you say ask for the advance directive. Now, have you? This is the medical history. And then allergies you have asked. So now blood group you checked. No, reconfirm. So surgery, have you undergone any surgery operations in the past? Any family history of any concern? The increase in blood pressure, sugar, or any clots in the family? What do you do for? So what do you do for living? And how is the support at home? Do you have good support at home? I see that your the BMI, that's height rate issue, is 28. Then how anytime did you feel down or depressed anytime? Because this is common during pregnancy, you need to ask every visit. How far do you stay from this hospital? Because she's near term 35, anytime she can deliver. So how far do you stay, Jasmine, from the hospital? Will you get transport easily, or will it take time to reach the hospital? This is about the information gathering. Would you like to add anything? Make sure that you are not missing anything, and patient is also not missing out to give you the information. Now, see, Jasmine, I will, if you permit, I will ask my nurse to check your blood pressure and pulse rate. Then, because the examination findings are not given, you will tell her, I will examine your tummy to check the baby's heartbeat. We will also check urine for protein, and I'll check then. So, I will also check heartbeat, baby's heartbeat, and also baby's position. Okay, now, then coming to the discussion, you are going to discuss about the this case, that is applied clinical knowledge. So here, now Jasmine, let me explain to you. Our midwife has examined you and she felt baby's bottom down. And this is commonly, commonly 96 and 96 out of 97 out of 100, the baby's head is down. But sometimes what happened, and sometimes in some cases, they may be bottom down. So that is, we check only near term. If it is head down or bottom down by near term, then it will be remaining like that most of the time. So, and so only in 3 to 4 out of 100 babies maybe bottom down. So let me tell you what is better position for the baby's delivery. So delivery of the baby with head down is safe, Jasmine, is much safer than the bottom down. You know why? Because head is the largest part of the body, of the baby's body, and they delivered first. It is delivered first, followed by the rest of the body easily. On the other hand, if the baby's bottom is down and it is smaller than the head, so it comes out first, and the bigger part of the baby, that is the head, it comes at the end. And sometimes in this situation, there can be some issues during the delivery of the baby. These are the inherent issues in the baby breech delivery. So, then there can be small risk of baby dying around the time of the delivery. And it can cause some short-term complications to the baby, but it's not to scare you. I don't want to cause scare. Don't want to make you scared of this. Just I want to tell you what can happen if the bottom is down and you want to have a breech vaginal birth. But let me tell you, there are no long-term effects if the baby delivers with the bottom down, as vaginally. So then let me tell you, am I clear so far? So then in this situation, then we have, because as I told you that head down, the baby will be, better option will be head down. So here, because you have bottom down, we have three options to discuss. Shall I explain to you? Shall I proceed? Yes, doctor. So then after I tell all these three options, you can, I already told you, you can decide. And whatever decision you take, we will respect it. So now coming to the first option, what we have is, we will turn the baby. Turn the baby, your baby, which is into the, your baby is in bottom down. So we'll turn it into head down position. That is first position. That is, it is called, in medical terms, extensocephalic version. So, Jasmine, are you with me? Yes, doctor. Now, it involves applying gentle pressure, but firm pressure on the abdomen, on your tummy. We will apply gentle but firm pressure and turn your baby to head down from bottom down position. And when it is done around 37 weeks, because you already have delivered before. So it is done at 37 weeks. And we can do up to early stages of labor. When you set into labor also, initial early stages, we can do up to that time. So now, let me tell you, shall I explain to you step by step about it? About this procedure, that is turning the baby into head down? Yes, doctor. So it is done by expertise, and it is done in the hospital setup, because where the facilities are there, in case a cesarean need arises, we can take you for cesarean section. The facilities will be there. So it is done in the hospital, done by the expertise. And before we do this procedure, then we sometimes we give a medication to make it, the uterus, the womb, relaxed, so that when it is relaxed, it improves the chance of turning your baby. And this medication is given as an injection. It is a safe medication. Sometimes it may cause some flushing, and you may be aware of your heartbeat beating faster, but it is for a short while only. So am I clear? Yes. So now, before this procedure, we will also do a scan and see to confirm that the baby is the bottom down only. Then we will check the heartbeat. Baby's heartbeat also we will check before the procedure, and we will check the baby's heartbeat after the procedure also. And we will also check your pulse rate, your observations we will check, and your pulse rate, blood pressure also is checked. Now we do this procedure, under the scan guidance. It is generally, let me tell you, it is generally safe procedure with low complications, both for mom and for the baby. So it may cause some discomfort, Jasmine. It may cause some mild discomfort for the mom, but generally it is safe. And it takes a few minutes only. You can go the same day home. You can go home the same day. But on the other hand, let me tell you, it can cause it can cause some problems also. That is, after the procedure, there can be some bleeding, or there can be some concerns with the heartbeat. In that case, we will do emergency cesarean section. So, am I clear, Jasmine? So, this situation arises in 1 in 200 cases. So, very rare. If sometimes there can be some pain. It's not discomfort, it's more than discomfort. You may feel pain. In that case, we will stop the procedure. We will not do the procedure. Now, the third thing is, let me tell you, it is successful. It is successful in 5 out of 10 women. When we do this procedure, it is successful, and it remains as head down only. So then we can go ahead and deliver you normally at home. So you can have home birth once a baby is head down and fixed and remains in the same position. However, let me tell you, sometimes what happens, they may be, even if the head comes down and remains stable, they can be need for cesarean section. Sometimes the labor can be, you may not deliver, it may take longer time, and unable to deliver vaginally, then we may have to take you for cesarean section. Sometimes we may have to use instruments like spoons, cup and spoons to deliver the baby. So this way it can happen. And sometimes after this procedure, that is turning the baby to bringing the head down, sometimes it may not be possible to do this procedure. we won't be able to do. In that case, we can try again on another day. We will ask you to come another day, but we will be doing with your permission, with your consent only. The other thing is, if suppose still it is not successful, then then we will have options which I am going to tell you. I will have other options to do. The other thing what I want to tell is, suppose it is successful, still head comes down. I mean, the bottom goes up and head comes down. Still, it can go back to her previous position. That is, the bottom can come down again. So in these situations where it is not successful, or it again comes back to its bottom down position, in that case, there are two methods. Can I explain to you those two methods? Yes, doctor. So then this is, we can do a planned cesarean section. We can do a cesarean section. In such cases, planned one, we fix a date and do. And the other one is planned vaginal birth. So coming to the first option, that is the cesarean section, it is done as a planned cesarean section. That is, we fix a date and do. It is done around 39 weeks. When if the baby remains bottom down only. So towards, so it is safer. What are the benefits and risks of this cesarean operation? Shall I tell you? Yes. So the benefits, it is safer for the baby. Cesarean is safer for the baby than vaginal birth. And so, but for the baby, it is safer. For the mom, there may be some risk for the mother. That is risk from the cesarean section and also risk from the anesthesia. And so, there can be risk. What are the cesarean risk from cesarean? There can be some bleeding, there can be some injury to the surrounding organs, bowels like that, or there can be infection. And what can be this risk from anesthesia? There can be some complications from the anesthesia also, which the doctor will explain to you before he gives the anesthesia. So, and other thing what what issue can be there is in future pregnancies. If you're planning future pregnancies, if this time we do the cesarean section, in future, there can be some issues with the afterbirth. The afterbirth can go into the wall of the womb and get fixed there. That can lead to some problems during labor. Sometimes we may have to do another cesarean section in the future pregnancies. And also, there can be sometimes the heartbeat of the baby can stop during labor, during this waiting time. There can be stopping of the baby's heart. That's called stillbirth. So these are more. So this is about the cesarean section. Shall I tell you about the other option? That is going for vaginal breech birth. With the breech going for vaginal birth? Yes, doctor, I want to know about that also. Okay, so it is advised. We can advise vaginal birth with the breech, with the bottom down, but after confirming few things, after making sure that the baby's few things, like we do the scan and see what is the position of the head. Here it is bottom down. So what we want to see how the position of the head is, whether the neck is tilted backwards. This is very important. When it is tilted backwards, we will not go for vaginal birth. Then second thing is, we will see the bottom down position, whether her feet are below the breech, below the bottom. That is where we won't allow for vaginal birth. The third thing is, baby's weight should be appropriate. It should not be too big. It should not be too small. It should be average. Then other thing is, whether if after birth is not normal, it is in the lower part of the womb, then also we will not advise. It's not advisable to go for vaginal birth. Or if there is any problem with the increase in the blood pressure or increase with the protein in the urine, that is called preeclampsia, such conditions, we won't allow for vaginal birth. So now, if everything is fine, after doing the scan, if we feel that everything is fine, we will allow you for vaginal birth, vaginal breech birth. That is, breech we will deliver by vaginally. But one thing I would like to tell you, Jasmine, it is done by experts who are experts in delivering the breech babies. They should be available. So it should be in a hospital setting. Because at home it is not possible, because it should be in a hospital setting, where anytime there is any problem arises during delivery, we have to do the cesarean section. Facilities are available. So then, other thing which I want to tell you, sometimes we may while allowing for vaginal birth, we may have to take you for cesarean section if any emergency arises while waiting for vaginal birth. So am I clear about this option also? Yes, doctor. Now, what are the benefits of this vaginal birth? Let me tell you the benefits. There are, of course, benefits for the vaginal birth. For the mom, especially, because then shorter hospital stay, quicker recovery, future births will be easier. And the maternal risks are very least. But on the other hand, for the baby, risk will be more. But let me tell you, the risk can be short term only, no long term complications. And the other thing is, for the baby, I want to tell you what are the problems that can come for the baby during birth. For the mom, no problem, not much problems. But for the baby, there will be increased chance of baby dying during vaginal birth. The chances are more of baby dying during birth. That's called stillbirth. Sometimes what happens, Jasmine, cord can come out before the baby. I mean, baby delivers, the cord can come out. In that case, the heartbeat can vary. That is because of the compression pressure on the cord, and then we may have to go for emergency operation. Third thing is babies. When after the baby's bottom is born, quickly comes out easily because I told you it is a smaller part. The head when it comes, it cannot come because when neck of the womb is not fully open. So these are the problems which the baby can face. So now that I have given you the options, all the options, now with the risk and benefits. So now you can take it. You can discuss with your partner, and you let your midwife know. And also by next visit, you can discuss with our consultant also. Now, Jasmine, you're 35 weeks. So we will plan once you decide for the turning of the baby, that is extencephalic version, that is done at 37 weeks. Now that you're 35 weeks, we will plan it after 2 weeks. So this is the information leaflet which about the breech birth options and which I have discussed. So you can go through this. I will document whatever we have discussed. I'll connect you to the support group. And also I'll give an appointment with my consultant next week for the next week so that you can discuss with your partner and come and tell us. So then, would you like to, do you have any other concern? So no or yes, she will say. Then you say, let's say this is a 24-hour contact number. Because she is near term, anytime she can develop any problem. Anytime you feel pain, if you feel any bleeding or leaking or any pain in the tummy or baby is not moving properly, then you come to the accident emergency immediately. So now already you asked her what any concern, she has any concern. Now we can close the station. Thank you for speaking to me. Jasmine, if you remember her name, you say. Otherwise, if you don't remember her name, don't tell any other name. Don't say the name if you don't remember. So this way, I told you about the breech because there is a very important station. It took some time for me to tell you, but you need to present it in the 10 minutes in the exam. In the exam, you need to present in the 10 minutes. So you practice, and depending upon what they want, sometimes they will ask only extensive version, or sometimes only vaginal breech birth. So depending upon what the station is, you can take into that, or briefly say about all the options if nothing is mentioned, if they just say management. So okay. So this is about the breech management. So next time we'll meet.